Welcome to Wanja's Health Diary. This morning we'll talk about retinoblastoma, a type of eye cancer that mostly affects children. We are delighted to have Dr. Kimani, who's going to take us through retinoblastoma. Karibu sana daktari.
Thank you.
It sounds like a really big word, but what is retinoblastoma?
Retinoblastoma, as you have correctly mentioned, it's a cancer of the eye that affects young children. Usually it will affect children below the age of 3 years, but in our setup, children present late. So many of them, the disease will have started early, but they will still come quite late. But in most cases, it will be in children below 5 years by the time they come to the hospital.
Okay.
Yes.
And I'm sure then they present late because of lack of awareness.
Yes.
On what the signs and the symptoms are.
Yes.
Can you take us through what are the signs?
Retinoblastoma is one of the cancers that announces itself, and it will keep telling you, I am here, because the most common way in which it presents is something in the eye of the child. Initially, it may not be that obvious, so like when they put on the light in the evening, then they will see that there is an abnormal glow in the eye of the child. You know, like when you shine the torch in the eye of a cat at night and it glows, that's the way it looks. But now as the cancer continues to progress, now it becomes more and more obvious to the level where you can now see it even during the day. And usually it will be seen as something white inside the eye of the child.
Okay.
In a few cases, it may present as the eye not looking straight. So instead of the two eyes looking straight, one of the eyes may be looking outwards or inwards.
Is it what we call the squint eyes?
Exactly.
Okay.
Exactly.
A parent comes to you and says, I suspect my child is having an abnormal eye. I'm sure at this point, then they don't even think about cancer.
Yes.
How do you go towards confirming? How do you arrive at the diagnosis?
Retinoblastoma is one of the cancers which you can just diagnose by looking, even without doing any specialized tests. A qualified eye doctor will be able to look, and in most of the cases, they'll be able to diagnose the eye cancer without even doing any further test. Mm-hmm. And even with just that diagnosis, they'll be able to take the appropriate actions to treat the child.
Right.
So it is a cancer that presents in a very obvious way, that even without many gadgets, one is still able to diagnose it when they are properly trained.
Okay.
Yes.
Upon diagnosis, I'm sure then the parents then ask a lot of questions.
Yes, they do.
Can you take us through probably some of the risk factors and whether it runs in families?
Yeah, that's a very good question. In most cases of retinoblastoma, in about 95% of the cases, the child that comes with the retinoblastoma will be the first person ever in that family to have had that kind of cancer. And in most cases, the parents, the relatives, they'll never even have heard of it because it's a rare cancer. In about 5%, then when you take a good history, then you will find that maybe there are other children in the family who have had similar problem, or cousins, or aunties, uncles, grandparents. But this is only in 5% of the cases. And when we see a child with retinoblastoma, we are always very keen to find out whether anybody else in the family has ever had such a problem.
Okay.
As you say, there is a risk that it can be genetic or hereditary, which means that it runs in the family. And there is this abnormal gene that can be passed across generations. So even in this child who has presented with retinoblastoma, even if there is nobody else in that family who has ever had retinoblastoma, now if they survive this cancer and grow into adulthood, their children now will be at very high risk of having this cancer.
Okay.
Yeah.